Welcome to this podcast series exploring women's lived experiences of gambling harm and the ways gambling has become part of women's everyday lives. This series is part of a broader project looking at how gambling is becoming normal for women and can often feel hard to avoid, showing up in places where women socialise, connect, celebrate, and go about their daily life. My name is Dr. Simone McCarthy, and I'm a public health researcher at Deakin University. My research focuses on the commercial determinants of health, particularly how industries like gambling shape everyday environments and experiences of harm for women. Today, I'm joined by Dr. Elisabeth Yar, who is the Policy and Research Manager at the Alcohol, Tobacco and Other Drug Association in the ACT, also known as a TODA. Elisabeth has a background in anthropology and has led significant work exploring the intersections between gambling and alcohol and other drug harms. Through this work, she has collaborated with researchers, practitioners, and people with lived experience to better understand how these issues overlap and how services can better respond to people experiencing complex and co-occurring harms. Thank you so much for joining us today, Elisabeth.
Thanks, Simone.
Before we get started, I just wanted to acknowledge that today's conversation may touch on experiences of gambling harm, mental health, alcohol harm, stigma, and recovery. Please take care while listening, and if anything discussed raises concerns for you, support services are available in the show notes. So to start, when we talk about co-occurring gambling and alcohol and other drug harms, what do we actually mean?
So what we found is that people are often experiencing more than one type of harm in their life. So we're really focusing on when there's that intersection of different types of harm. So when people are gambling and are also experiencing issues with substances, whether it's drugs, alcohol, we didn't look so much at tobacco and nicotine, but we also know that there's quite a crossover in terms of smoking and gambling. So we just know that these issues come up often for people at the same time or across their lifetime as issues that they might face. And that when you are experiencing harm from gambling, if you're also experiencing harm from drugs and alcohol, there's often a compounding effect. So the harm actually becomes greater and people end up in a worse situation, whether that's financial, their health, relationships, and we do know that these issues sort of impact people across all different areas of their life. So our work has been really focused on that intersection of harm between gambling and substance use.
And why is it important that we don't just think about gambling harm in isolation?
Well, it's really helpful for people to think about their life as a whole when they're seeking support and help. So people don't come with one issue that can sort of be ticked off and we go, okay, we can solve this part of your life, but our lives are much more complex than that. And I think we all know that and experience that when we have sort of one thing going on, it often has an impact on these other issues as well. And if you try to respond to those issues in isolation, you can actually find that you increase harm in another area. So you might be very focused on the gambling, but if you're not understanding that somebody is, using gambling in certain circumstances where there's also alcohol present, and you might be dealing with the gambling but not dealing with the alcohol, you may actually find that you increase the harm from alcohol. If you're looking at these issues and there's other things going on with the family that then are impacting, the gambling's impacting the family relationships. Dealing with the gambling is perhaps not going to solve some of those other issues going on if there's a lot of substance use or the problems that come along with that as well. So dealing with people holistically, we like to put the people first and think about, what's going on for them and how can we improve people's lives across the board, rather than trying to deal with issues in a piecemeal way, which can leave people either not better overall or, in fact, increase harms in other areas.
Yeah. And so you might not know, but what kind of prompted a TODA to focus on gambling?
Yeah, so we ended up in a project or leading a project on understanding and responding to co-occurring gambling and substance use harms in service settings. And this came about from conversations that we were having with our member organisations. So we're the peak body for drug and alcohol services, so in the ACT. So our members are treatment services, drug and alcohol rehabilitation services, harm reduction services, drop-in services, counselling, offer a whole lot of different types of treatment and harm reduction for drugs and alcohol. And what we were hearing from our service providers, so from workers on the front line, is that more and more they were interacting with people who had really complex lives and had a lot of things going on, and gambling was one of those complexities. So we were really fortunate to receive some funding for the project from the ACT government, and were able to develop a practice guide that would help workers, frontline workers in AOD services in particular, but also health and community sector workers across other organisations, to know how to respond to those issues when they could see that somebody wasn't just, somebody was turning up at a service saying, I'm struggling with my alcohol use, or I'm struggling with methamphetamine use. And you start to unpack that at an intake or in your counselling sessions, and it becomes really obvious that, they're also struggling with gambling. They're also finding gambling really problematic for them. So we wanted to develop a practice guide that would help people with that as an issue that was becoming more and more frequent and obvious to our workers.
And did you feel that those people working on those frontline services were trained in understanding gambling harm, or?
No, so this is the other area that people really just didn't know what to do. So we're really proud of our workers and our sector in the AOD sector, and we know that they're really capable and that they deal with a lot of co-occurring issues. They deal with a lot of mental health issues, a lot of things like domestic violence, domestic and family violence, physical health issues. There's a lot that they deal with, and then there's a lot they're presented with. But they were telling us that we don't really know what to do with gambling. We don't know where to send people. We don't know how to have those conversations. It's catching us out. We're being caught out. We're being surprised by this issue. We thought that we were, we're established a relationship with somebody. We thought that we were dealing with the main issues in their life, and suddenly we discovered that there's something else going on for them as well. It's gambling. There's a whole lot of financial issues, relationships breaking down over this, whatever it is, and that wasn't immediately obvious. People had kept that hidden, and they wanted to know what they could do. So yes, we know that there's a lot of capability to deal with co-occurring issues, but gambling was just an area that maybe we needed a little bit of a boost, needed a little bit of support to know how to deal with it.
Yeah. And you talk about in your practice guide that you found that alcohol and gambling are often linked culturally or socially in shared environments. Do you have anything to say about that?
Yeah, absolutely. So there's a huge number of similarities between the alcohol industry and the gambling industry. So really similar tactics in how they advertise, and a really similar sort of position in Australian society. So we see that alcohol and gambling are both very socially acceptable in Australia. They're seen as ways to socialise and to have fun, maybe to celebrate. They are part of major holidays. So you think about, you've got things like the Melbourne Cup, where gambling is really the major focus of the day. But then there's a whole lot of, Christmas, New Year. These are times of year where there's often a large focus on alcohol and on drinking, and that social aspect of it. And these can be, these can be really important to people. They can be really deeply embedded in people's cultural identity. We also see, of course, that alcohol and gambling take place in the same places. So we have clubs and pubs where there's poker machines, where there's gambling taking place, casinos. Obviously, there's that there's both of these things happening, and sometimes happening in ways that the gambling can play into people drinking more, and the drinking can play into people gambling more, and this can be a really significant issue. Now, I think one of the other things I'd pull out from this is that there's some really similar ways that this impacts women in particular. So these have traditionally both alcohol and gambling have sort of been seen as masculine activities. So maybe women haven't been targeted by the industries in quite the same way in the past. However, both industries have discovered, this whole 50% of the population. But there are some really interesting ways that both of these issues impact women slightly differently to the ways that they impact men. Impact them the same ways in lots of ways, but impact them in some really specific ways as well. So I mentioned that our services deal with domestic and family violence. So this is an area where we see women are particularly impacted, and there's a big intersection with gambling and alcohol use. Also, that sort of cultural, the masculine culture around both drinking and gambling can become a barrier to women seeking treatment.
Yeah.
And we know that women are significantly less likely to be seeking treatment for drug and alcohol use. And the data is telling us that women are less likely to be seeking treatment, are perhaps less likely to be facing significant issues with drug and alcohol use, but still more. They're still experiencing issues at a higher rate than they're seeking treatment when compared to men. So we know that there's some sort of barrier to women seeking treatment for this. And we suspect that some of those same barriers are in place when it comes to talking about gambling, when it comes to seeking treatment for gambling. So there's a lot of stigma around women gambling and women using alcohol. Again, that comes back to this kind of acceptance in culture around it being a masculine activity. There's often some very real practical barriers in terms of the involvement of children, concerns about things like child protection getting involved in situations where there's really problematic issues going on with substance use or with gambling, and it's affecting family relationships. And just some really practical issues around services and whether they're oriented towards some of the specific needs that women may have compared to men. So some work to do perhaps across the sectors in responding to women's specific needs.
Yeah, absolutely. And I wonder if some of those, alcohol and drug services, it might be seen as more masculine, or like more something that men go to, more of the pointy end, and I'm not there. It's interesting, kind of that gendered expectations, I guess, that would influence help seeking. I wanted to go back to, the social environments where gambling and alcohol are present, intertwined. Do you think we pay enough attention to the role the environment plays in driving different harms?
No, absolutely. The environmental issues there are really significant, and I think there's a few different factors there. One is around the concentration of particular types of businesses that promote or have gambling, or promote and have alcohol in certain areas. So we know that there's certain concentrations of these happening in different areas of the ACT. Now, we're pretty fortunate in the ACT that we don't have some of those real distinct areas of like impoverishment and then wealthier areas, but we do have some of that, and we do see that there is an alignment of some of these services in some of these businesses in lower socioeconomic areas, and and often together. So we see those sorts of businesses operating in the same areas. And then I've sort of already mentioned, yeah, so clubs obviously are there for the purpose of gambling and of drinking alcohol and doing that in what's promoted as a social environment. Pubs, the same, many of them, of course, some in the ACT, many in the ACT do not have like gambling facilities in them, but again, there's issues around what the co-location of these, but actually, what are actually really harmful products at the end of the day.
And there's definitely evidence to support that poker machine venues are concentrated in areas of lower SES, and they're also the communities that are losing the most on poker machines all around Australia.
Yeah.
You mentioned in the practice guide the concept of harm by design, and I really liked this language. Could you explain what this means?
Yeah, so this is a term that we actually heard from our lived experience people, particularly in the gambling lived experience space. This is people who have experienced harms from gambling and are using that experience in order to try and have an impact on policy, or are using their experiences of gambling in services, in counselling services, and so on to support people. And we were hearing this term from them, so harm by design. So, and we thought that actually really applies to some of our other legal industries like alcohol, like tobacco. These are products that involve harm by design. So there's an awareness, an acknowledgement, and a willingness by the industry to inflict harm on people, and they're very aware of the harm that these products cause. And I think here the tobacco industry can be quite a good sort of case study, because we're a little bit further along perhaps in recognising some of the industry tactics and some of the way that they have downplayed the harm, minimised the harm, in the way they talk about it, in the narrative, so the harm hasn't actually been minimised, but have tried to make less of the harm, and have done their best to push back against policy changes that would limit that harm, and actually a lot of that has been exposed. We had very significant changes around what could be done in advertising, and of course, a lot of the harm reduction messaging that has happened around tobacco. So on the cigarette packets, on the actual cigarettes themselves, and so on. But we don't have that same broad recognition. I think people do know about the harms of gambling, and we know that from surveys that have been done in the population. People do understand the harms of alcohol. We don't have that same sort of broad acceptance that this is harm by design, and the same sort of understanding and insight of industry tactics there that are pushing harm and benefiting and profiting from harm.
Absolutely. And I'm sure gambling and alcohol both have that individual responsibility language. People can gamble or drink without having problems. Therefore, it's the personal issue of the person rather than a really harmful industry.
Yeah, and this is a narrative that is really pushed by these industries, and it's so incredibly harmful because it does place the onus and the responsibility back on people in a way that can be incredibly stigmatizing. So we then tend to have people feeling blamed for the problems that they're facing, people blaming themselves for the problems that they're facing, and people being blamed by others around them, including, unfortunately, healthcare professionals, and facing that real stigma when they go to get help from services that should be there to support people and help people at these times. So stigma is a real barrier to people seeking help as a real barrier to people receiving help. And we know that both gambling and substance use are heavily stigmatized. People stigmatize themselves when they're experiencing issues with these things. And when you combine them and you have that co-occurring harm, you have an accumulation of stigma around it that can make it extremely difficult for people to get the help that they need and to be open and to have those conversations that they need to get started on the right path, to find the right people to help them. And of course can be very hard for families and others around them as well, because of that stigma. And just getting back to the practice guide, I think this is a lot of what we were, the underpinning impetus around creating this practice guide was to make sure that we were helping our workers to think about and challenge maybe some of their own stigma and biases around co-occurring harms, maybe some of their own, so AOD workers maybe not having the same knowledge around gambling, just being able to challenge and think about what they're bringing to the table in terms of their experiences or biases, and how they might be able to unpick some of that in order to, help people, as we know that they're there wanting to help people, to be able to help people in the best possible way.
Yeah, and that's great. And that's similar to the idea of this project is about raising awareness, I guess, that gambling does harm women too, so that people feel like they can put their hand up for help, and that they receive that help when they go to a service. So I wanted to talk a bit more about women. And yeah, you mentioned that kind of family violence aspect, but are there particular pathways into harm that services should be aware of for women?
Look, there's probably a few different ways to think of this. So I think underpinning it, so people experience harm, and there's an element of that harm from gambling and substance use that is not gendered at all. So this can be experienced by anybody, and that's actually a really important message as well, because we know that some of the expectations that it's men perhaps that experience this harm has actually perhaps had a detrimental impact on women recognizing and understanding the harm that they're experiencing. However, there's other elements of it that can be, I think, quite gendered. And I think that it's really important for services workers to understand that might look different. It might look different when it's a woman who's experiencing co-occurring harms to a man. I think so there's a few areas of difference. I think one of the areas that people who are working in this sector need to be aware of is around domestic and family violence, and around the home and the domestic space, and what that might mean for women, and where women's own gambling or substance use might fit into that picture. So I think we know that young women are more likely to be experiencing harm from somebody else's gambling, also more likely to be experiencing harm from somebody else's substance use. So in terms of that impact on relationships, issues like domestic and family violence, also economic issues, so issues around who's controlling perhaps the finances. Again, this can drift into issues around domestic violence and coercive control. So we're not just looking at outbursts of violence in terms of perhaps substance use, but understanding that there can be all sorts of issues that might not be immediately recognised here. And understanding potentially the financial resources that may be different for women, particularly for perhaps women with young children or women with children who've been out of the workplace for a period of time? What are some of the financial issues that may be potentially driving gambling or maybe contributing to further harm if there's an issue of like coercive control or domestic violence there around finances? So understanding that women can face the same gambling or substance use issues as men is really important for workers. Understanding that there may be things that present differently is also really important. And thinking about what are the barriers that perhaps are stopping women from seeking treatment or stopping women from speaking up and being able to start addressing those. So, is it an issue of children and that services are not well suited to bringing your child to the service or to managing visiting a counsellor during work and school hours, managing that kind of balance? Is it around concerns about child protection being involved? Is it around concerns of partner violence and having to factor a partner into how this is being managed and how it's being talked about, and whether you're exposing things that are you're expected to keep quiet about in the domestic environment? So I think this is quite important for workers, and I think just having that awareness of the broader circumstances that anyone's turning up to a service with, but the broader circumstances that a woman may be turning up with that could be complicating treatment, could be complicating those interactions further.
Yeah. And do you see people in your services that are seeking help from someone else's gambling?
Yeah, absolutely. So we know that harm from gambling doesn't just affect the person who's gambling, affects a lot of other people around them. And this is true for people who are themselves using substances, that it's not unusual for there to be other issues going on in the personal relationships, in the family relationships, for example, or indeed if they're seeking help for someone else's substance use and there is gambling involved in that as well. So yes, absolutely, and it can be a very hard one for workers to unpick. And one of the things that came out very clearly in our as we were developing our practice guide and talking to workers and talking to services, is that this is often not something that will be addressed. Gambling is not often something that would be addressed in an intake call, for example. So it's not a matter of filling out a form that says, are you experiencing harm from gambling, or doing one of the great gambling screening, using one of the gambling screening tools, some of which are fabulous and some of which are a little bit ho-hum. But it's often not a matter of having that conversation at that initial point of contact. It's often a much longer process of working with somebody over a period of time and sort of starting to unpick, what's underlying the substance use. What are the other issues going on for you? What are the other issues in your broader relationships? And how can we address that in that holistic way? But, when somebody attends a drug or alcohol service, they've taken an enormously brave step often, but also an enormous step. We know it takes years for people to often even seek treatment and then to receive treatment. So it's a long process. And, that often means that someone's in a good place to address other issues, but also it can sometimes just be overwhelming. You've got this far, you're wanting to address your, really problematic drug use. It's had a whole lot of impacts in different areas of your life. people are not always ready to like start dealing with another issue at right the same moment as well. So
Yeah.
there's some real sensitivities around how workers address this, and it's all about person-centered, person-led approaches that really recognise that people come with different experiences of harm, different backgrounds, and whether that relates to gender differences or just to individual, all of the individual differences that people come with, there's, you know, a sensitive approach that needs to be taken.
Yeah, yeah. And I think when we talk about, gendered approaches or being more, gender responsive, I guess what we're really talking about is that holistic people first. You address just the person that's in front of you, and their own realities, I guess, rather than, sweeping everyone with the same brush.
Yeah.
What do you think services sometimes miss when responding to women experiencing gambling harm?
So I think we've probably become so I think we're probably getting there around some of these intersections with gambling, substance use, and domestic violence.
Mm.
However, there's often there's perhaps a tendency to be more comfortable with viewing women as the the victims of somebody else's behavior in this. And I think it's what services might sometimes miss is how can actually be a strategy. Gambling may actually be a strategy. Substance use may actually be a strategy, a tactic that's used in response to domestic violence, can be a way of coping.
Yeah.
We know that a huge number of service users who identify as women at AOD services come with a history of domestic and family violence, either a fairly recent history or a longer history going back to childhood. This is, close to it's a very, very common experience for for women who have drug and alcohol issues to also be experiencing intimate partner violence or to have experienced it in the past.
Mm.
It's not, yeah. Again, when we see issues with gambling, this can be a way of women managing all sorts of circumstances in a situation of domestic and family violence. It may be seen as a way of accessing finances if that's not something that they have access to in the relationship. It may be a way of escaping and getting out of the relationship, of having a physical space to go that's not in the house. Clubs open late, poker machines running to very, very late hours. An often very welcoming environment, and often a relatively safe environment for women. If you ignore the harms that gambling itself is doing, it can often feel like a very safe environment for women to be in. And it's not an unusual pathway for women to end up in a situation of gambling harm, their own gambling harm, when there are issues in the domestic environment, in the home environment that they're needing to remove themselves from.
Yeah. Yeah. And I've done a bit of research into the that venues are open late at night and women feel safe to go on their own, and there's security and there's a big car parks, walking in the dark. And when we're thinking about strategies, I guess, or approaches to removing kind of that harm, we can't not consider all the positives that women are getting from those environments, like much needed refuge for some people. And we need to have alternatives that don't have alcohol and gambling and make the harms worse.
Yeah. So in the same way, I suppose that substance use, alcohol, other substance use, drug use, can provide a form of refuge, maybe not quite the same physical sort of space that a club might provide for gambling, But we know can be, a really significant and important way for coping with the situation that people are in. So I think this is something that services and workers can be looking out for,
Yeah.
and recognizing the complexities, and why why something like deciding to self-exclude from a club may be more complex and complicated than it's first presented. So there may be a whole lot of reasons why women are there in the first place, and why asking them or suggesting that they not be there at all could be quite a complex thing to achieve.
Absolutely. And then back to that holistic person, really understanding or
Absolutely.
yeah. Do you think gambling is discussed differently to alcohol and other drug harms?
In the general community, or yeah.
Yeah.
um
Or in the services as well?
yeah, okay, so yes, possibly. I think so I think one of the so we've talked already a little bit about industry and the
Mm,
industry tactics and so on. And I
mm,
think one of the issues, one of the sort of dividing issues in terms of how things are talked about, is between legal and socially acceptable um, products, which gambling is one of, and I think alcohol is another, and those that aren't, which would be your illicit drugs, and increasingly, I think, tobacco and smoking are probably fall into the not socially acceptable,
yeah.
or have not been
Yeah.
socially acceptable, although they are still obviously legal. So I think there is a divide in the way that we talk about and think about um, products differently, and there's some different issues that arise in terms of
Mm,
dealing with or thinking about illicit drugs and thinking about something like gambling and alcohol, so the legal
yeah.
products. Um, there's some, it can be very difficult when products are legal, and there's that stigma around responsibility and self-management, and other people can manage to do these things safely. Why can't you? So there's that element around illicit drugs. Of course, there's a whole lot of stigmatization around them being, the criminalization.
Mm,
So there's different issues there, and they're talked about in different ways because of that. How else are they talked about differently? Well, I think that gambling is still very much treated as a bit of fun, a bit of a joke. There's probably a little bit more responsibility in the narrative, or there's starting to be a little bit more responsibility in the narrative around alcohol,
mm,
particularly for young people. Whereas I'm not sure that we're quite there with some of the general messaging and the general thinking around gambling, and just the way we talk about it as, playing. All of the terminology around gambling sort of emphasizes the fun. Um, and there's a lot of blurriness in
mm,
what is gambling products as well, which I think is a little bit different to alcohol. I mean, there's some blurriness. There's been some blurriness in recent years around non-alcoholic products that look like alcohol,
yeah.
um, or alcoholic products that look like non-alcoholic products. So I'm thinking about sort of things like our hard solo.
Mm,
Um, uh, but the blurriness between gambling and not gambling, I think, is a lot more blurred. It's a lot
yeah.
less distinct, where the line falls, and we see a lot of sort of harmful products and practices that probably don't quite fall into the that's gambling
Mm,
space, but are definitely gambling adjacent, and
yeah.
um, can carry their own harms, but can also be introducing people who are too young to gamble, for example, to gambling, or introduce people who would not be out at a gambling venue to gambling in a much easier sort of environment at home, and then that slips into being actually gambling with money. So yeah, there's some issues there. I think where
Yeah.
we think about them differently, talk about them differently. We did develop, as part of our practice guide, we developed a language
Mm.
guide. And what we did find there is that actually a lot of the general advice around language is the same for
Oh, yeah.
whether you're working with illicit drugs, whether you're working with alcohol, or whether you're working with gambling. That really it's sort of broad um, thinking around, language is adaptable. Don't be overly prescriptive in the way that you talk. Take a person-centered approach to
Mhm.
language. Talk about the person rather than the problem. Make sure that you are challenging stigma with your language, even if the person who's there, um, seeking support, seeking treatment, is using stigmatizing language. Be prepared to sort of gently challenge that
Mm.
while taking their, acknowledging their way of speaking and their experiences and their knowledge. Um, recognizing that language is local and that if you're thinking about using a language guide, that it might not be applicable to your local circumstances or to the people that you're working with. And then the advice that we give to everybody is, don't sweat your language. Language mistakes happen. You might use something that we consider to be not the right language. You might talk about uh, um, I'm trying to think of what we would say that we shouldn't be using in gambling.
Like problem gambling.
Yeah, you might use the term problem gambler inadvertently. Look, it's fine. Mistakes happen. You apologize. You move
Yeah.
on. We might talk about someone being, getting clean. We try not to use that type of language. It's quite stigmatizing of people
Yeah.
who use drugs, clean and
Mm.
dirty. So these things happen. Don't sweat your language, but be
Yeah.
prepared to learn. So really similar advice we found across whether you're dealing with gambling issues or dealing with substance use issues.
Yeah, that's really I guess fascinating, the similarities. And one of your key messages in the guide is the importance of collaboration between sectors. What would a more kind of joined up response to gambling, alcohol, and other drugs look like?
Yeah, well, look, it's great if we start having these conversations and we get the
Mm.
people in the room together. And I think that's been something that's been really valuable to have some of our services and some of our workers hearing from people who have lived experience of gambling harms, and getting involved in things like the gambling harm French communities of practice in the ACT, and I'm sure elsewhere they have similar uh, groups running. Um, there's certainly scope for people in AOD services to be more aware of gambling and gambling screening, and this is what the practice guide was trying to do. But we're also aware, and sorry, for people who are dealing with gambling issues, so financial counsellors and others who are dealing directly with gambling issues, to be more aware of substance use,
Mm.
co-occurring substance use issues. But we do know that services are often really under-resourced.
Yeah.
They're already dealing with so many issues. AOD services are funded to deal with substance use issues, and gambling is another thing that's on their plate.
Mm.
We're trying to support them to do this because we know that they're doing it anyway. But yeah, you know, projects or opportunities where people can actually collaborate directly, I think are really valuable, and get people talking and having those conversations across the sectors.
Yeah, absolutely. Any changes that would make a big difference for people experiencing these overlapping harms? What changes do you wish would happen?
I think again, it's probably just that greater awareness across these
Yeah.
sectors, and uh, our workers feeling confident and equipped and resourced to respond to these issues as they arise. Really clear, and this is where collaboration is so important, really clear pathways for referrals. So being able to walk someone through the referral process into another service or into another program. And, that's at the service level. I mean, at the broader sort of structural level, I think that there's probably a whole lot of work to be done around the way we advertise gambling and alcohol in the same sorts of spaces and as joint activities in the way that, and in the environmental, we talked about the environment in which they occur. And there's probably some work that needs to be done around pulling those apart. And yeah, giving people the best opportunity, the best possibility, best possible chance of not accumulating harms from multiple sort of issues at once. But we really need to be pulling apart gambling and alcohol as so deeply intertwined and embedded in our culture. So that would be my final sort of word on that one.
Perfect. And that's a great way to end. But thank you so much for sharing your work with us and the insights you've gained from that work. And we will put a link to that guide in the notes as well, so people listening can access and have a look at that. But again, thank you so much for being part of the series. These conversations are really important in helping people better understand how gambling has become normalized, and in opening conversations about support, prevention, and change. And just a reminder that if anything discussed in today's episode has raised concerns for you, support services are available. Thank you so much for listening. If today's discussion resonated with you, we encourage you to share this episode and explore the other episodes in the series to hear more lived experience perspectives and conversations about how we can better respond to gambling harm for women.